Hi everyone, my name is Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada. And today I want to talk to you about one of my most used and loved herbs of all time, and that is ashwagandha. So some of you may have heard of this already. It's becoming very, very popular, and for good reason. It's used for a lot of things. It can be useful for stress management, sleep, anxiety, depression, memory, boosting your immune system, reducing your inflammation, protecting your heart, and so on. So this herb is awesome. Now, I've talked in length about a lot of my favorite herbs for specific things, but I will say this is probably one of my favorite herbs of all time. It's a very, very useful thing that I use a ton of in practice, and that's why I wanted to talk to you about it today. Now, I won't be covering everything here. As you saw, there is a long list of things that this herb can be useful for, but today I wanted to focus on its role with your immune system and inflammation. So that means getting sick less often, recovering quicker from illness, reducing your allergies, reducing pain, reducing the severity of a lot of these chronic complex illnesses, because ultimately your immune system and inflammation are behind most chronic diseases. So that's why I wanted to spend a little bit of time talking about how this herb can be useful in those specific areas. And for those of you who are unaware, your immune system and inflammation are intimately connected. It is actually your immune system that will generate inflammation, usually in response to things like microbes, so viruses, bacteria, or if it's trying to repair something, so you've sprained your ankle, there's damage in the body, your body needs to mount an inflammatory response in order to heal that. So inflammation and your immune system go hand in hand. So inflammation is a very normal process inside of the body, and you do not want to stop it altogether, which is the goal of a lot of anti-inflammatory therapies. We want to be able to mobilize the immune system and mount an inflammatory response to fight off that virus, for example. But we also need it to calm back down, so it's not uncontrolled inflammation, which is ultimately what leads to chronic disease and destruction inside the body. So it's about finding a balance. And that's really the beautiful thing about things like ashwagandha or other immunomodulatory herbs. They really can stimulate the immune system to mount a good response when the immune system's down, but they're also very helpful for calming things back down when they've gotten out of control, when they've spiraled a little bit, which I know sounds a little too good to be true. But once I walk you through some of the uses of ashwagandha, for example, in the context of chronic stress, it will start to make a lot more sense, because it's not just an antiviral. It's not just attacking bacteria, viruses, or microbes or something like that. It's having a modulating effect on the immune system, a balancing, a regulating effect on the immune system. So it's able to help in both directions. So with that in mind, let's jump into some of the specific studies that have looked at ashwagandha's role with the immune system and inflammation. I want to start by talking about something like allergies, which are a massive problem. Allergic reactions have been on the rise for quite some time now, with anaphylactic reactions, for example, rising 615% from 1992 to 2012 alone. So to say this is a problem is a massive understatement. That's just one type of allergic reaction. So when they looked at ashwagandha in the context of allergies, they found some really interesting results. In a recent animal study, they measured the blood markers associated with type 2 inflammation, the type of inflammation associated with allergies. And they found that giving ashwagandha reduced markers like TNF-alpha, IgE, cytokines IL-4 and 13, all reliable markers of type 2 inflammation. So it's interesting, right? They're seeing that the administration of this herb can reduce these inflammatory markers. What is even more interesting, though, is in another animal study, they actually saw that turn into effective change of the tissue. So in the example of asthma, which is what they studied, they actually noticed that giving ashwagandha helped reduce the damage to your airways that can happen with uncontrolled asthma, with the uncontrolled inflammation associated with asthma. So we're not just seeing a drop in certain markers in the blood, we're also seeing how that translates to protection of the airways, the collateral damage that can happen when the inflammation becomes overwhelming for the body and your body starts to break down. And so again, this is just an animal study, but it really highlights how this isn't just helping a couple markers we measure in the blood, it's actually helping translate to a change in outcomes. So that's one example of how it's helping calm down an overactive immune system or uncontrolled inflammation. There's also the scenarios where we're deficient, our immune system is weakened and it's not mounting enough of a response, such as the context of things like chronic infections or cancers. Ashwagandha has also been shown to be helpful in that context as well. When they studied it in human studies, they found that ashwagandha could be helpful for both the innate and the adaptive immune system, which are two of our main categories of our immune system. The innate is roughly referring to our initial response, our first line of defense, and our adaptive immune system is referring to how we respond over time, how our immune cells can store memory so that the next time you're exposed to something, it will mount a quicker, more potent response to, say, that virus, for example. And so when they looked at this in human studies, they found that ashwagandha was able to stimulate a boost in a couple of our T cells, some of our antibodies, something called INF gamma, all of which are associated with both aspects of our immune system. Now, it can be hard to pinpoint exactly how ashwagandha is doing this, but one proposed mechanism is through hormones like DHEA and cortisol. These are hormones that are produced by our adrenal glands and are associated with chronic stress. So when we're stressed, our adrenal glands are really what release things like cortisol, our stress hormone. When they studied ashwagandha in the context of DHEA, they found that it will actually increase DHEA levels, which is really interesting because chronic stress, which is very bad for our immune system, has been known to lower those DHEA levels. Now, the same thing can be said for cortisol, but in the opposite direction. So a lot of the times, especially when we're in the early stages of dealing with a lot of stress, our cortisol will go up. And that is known to suppress aspects of our immune system when it gets too high. And ashwagandha is very good at lowering cortisol. So it has a balancing effect on these adrenal hormones that are associated with chronic stress. And we all know that chronic stress is not good for our immune system. It's often when we get sicker more often, have a harder time recovering. It's related to every illness and every disease you could ever think of. Chronic stress is a big problem in modern day life. And ashwagandha is probably actually best known for its effect on that system, on our adrenals, our brain adrenal axis. That is probably the best known use of ashwagandha. So hopefully I will have time to cover that in a different episode, but they think that this may be one of the ways that ashwagandha is indirectly helping your immune system is through these hormones. So that's just one of the proposed mechanisms. There are some in vitro studies, meaning like in a petri studies, to suggest ashwagandha would have direct antiviral effects, but honestly, it's not the first herb I think of in that context. There are much better herbs that have much more robust research behind it that suggests they're antiviral, like things like licorice root, St. John's wort, garlic extracts. Those are the things I think of in the context of more directly addressing bugs, for example. And so that's where Those herbs can be really helpful for like an acute cold or flu, for example. I think about ashwagandha more in the context of the chronically ill person. So, not just some healthy person who wants to recover quickly from a cold. I'm thinking about these people who have more chronic issues where they're getting sick a lot. They're dealing with chronic diseases that are driven by a poorly regulated immune system, uncontrolled inflammation, a deficient immune system. That's more of where I think of ashwagandha. Part of it is because it's useful for so many different things. That's why I feel like it's most helpful for the chronically ill person. It's more of a long-term solution as opposed to a quick fix. So the last thing that I want to leave you with is a little bit of more applicable knowledge around this plant. How is it being used? Now, I can't get into very specific dosages because it totally depends on the person and how you're trying to use this plant, but there are some general rules. So if we talk about the plant, we always have to talk about what part of the plant are we after, because these are big bushes and we definitely don't use everything. So in the context of ashwagandha, it's really the root that we're after. Now, there are studies that will use other parts of the plant, so I'll often see studies that look at like root and leaf extracts, and they will still see some good results with that. But the root is the highest concentration of some of those active compounds that they believe are doing the majority of the legwork. So that would be things like withanolides inside that plant, or saponins, or alkaloids. Some of these active compounds that they've studied that do a lot of the things that we're looking for as far as stress reduction, cortisol effects, immune boosting, those are found in the root. That is why you'll see a lot of these higher quality supplements that I rely on using either dried root or dried root extracts to put into their supplements. The other thing that can be really helpful is a lot of these companies will try to standardize for a certain percentage of withanolide concentration. So for example, one of the products I use a lot of has a standardization of 5% withanolide within that root extract. And that's probably one of the most famous compounds associated with ashwagandha. And so that's why they're standardizing for that particular compound. And that brings us to an interesting point, which is that it's hard to standardize within herbal medicine. You're using the whole plant. That's one of the major criticisms associated with herbal medicine is scientists want to know exactly how much of every single ingredient. But when we're using extracts or whole plant parts, it's really hard to do that. So for example, if you eat a cup of broccoli, there's no guarantee there is that much magnesium in that cup of broccoli. Every batch grown can have slightly varying levels, but we still eat it knowing that it's good for us. So the same thing applies to herbal medicine. There is some things that we know, but there's always going to be a level of uncertainty. So a lot of these higher end supplements will try to bring some certainty, saying that like, we know this is a good batch of ashwagandha root because it has at least 5% of this active compound that we know is at least one of the most important compounds within that plant. And so that's something else that you can look for. Now, it's not just dried root or dried root extracts that they're using. Sometimes you'll see tinctures or teas made, but it's really those are the main forms. And then the other thing is you do want to use something like ashwagandha more long term. So this isn't something that you take for a couple days. You often will take it for weeks to months. And there's a lot of good safety around this herb. So there's not a lot of long-term toxicity concerns. In fact, the biggest toxicity concerns associated with ashwagandha is often gastric upset. So things like nausea, vomiting, diarrhea. It's also not recommended to be given when someone is pregnant, mostly because we don't know. There are not enough research studies in pregnant women to confidently say this is safe, so that would be the other area where I would not use ashwagandha root. And the last thing is the general range of dosage being used for that root extract is 1 to 6 grams. So if you were to powder it up, roughly 1 to 6 grams of ashwagandha root is being used for most contexts. Now, that is all I'll say about this herb today. I do plan on doing a future episode soon here about its use for stress and sleep and some of those other very well-known things around ashwagandha. So stay tuned. If you have any questions about its use for inflammation and the immune system, please comment them below. And thank you again for listening.